Hello everybody and welcome to the Thursday edition of Video Clips, and I have a couple of disturbing things to talk about today, and I want to return to a topic that I actually discussed on Tuesday, which was screening, routine screening. I'm very much opposed to this. Medical profession loves it because it takes healthy people and turns them into sick patients. It's true with blood tests. Anything outside the reference range is likely to result in a recommendation for drugs or supplements, even if the abnormality is detected for the first time and it's insignificant. And so often these tests are not evaluated in consideration with the person's health history and their health status and their habits and that sort of thing. It's one of the reasons people are so over-medicated. The practice is even worse in mental health. The U.S. Preventive Services Task Force recommends that primary care docs screen adolescents for depression every year starting at the age of 12 and then until age 18. There are a lot of different screening tests, but they all have one thing in common, which is that most of us, if we took them, would qualify for a diagnosis, whether or not there's anything wrong with us, and they almost always lead to prescribing drugs. Some of you might have participated in my advanced study program where I cover Peter Gacci's book called Deadly Drugs and Organized Crime, where he and 7 colleagues got online and took some of the tests for mental illness. And many of them diagnosed with depression, ADHD. These are esteemed research associates from all over the world. And one was told to proceed to the hospital immediately for medication, and 7 were diagnosed with mania. So that's the extent to which these are disease-mongering tools. Well, I contend that the decision to prescribe drugs should be mitigated by the fact that drugs are useless and harmful, first of all, and that they increase the risk of suicidal ideation and violence in children and adults. The physical side effects are heinous. I've written at length about this in other articles. I'm not going to regurgitate all that here. I'll just refer you to the Health Briefs online library to learn more about that. Most of the kids, and adults for that matter, who are diagnosed with depression or anxiety are actually just responding normally to life events. And so instead of helping kids to successfully address and deal with life, things like overcoming the death of a family member or a relationship breakup, difficulty in school, disagreements with friends, we label these kids as having a chemical imbalance, we give them drugs and call them diseased. No life skills are developed, nothing is learned. Now, the drugs impair the ability, particularly for adolescents, to make connections between behavior and consequences. The frontal lobe, which is responsible for reasoning and problem solving and the ability to predict outcomes, develops throughout childhood and into the early 20s. Teenagers are not known for their excellent judgment and well thought out choices, and drugs can further impair decision making and prevent normal development of the frontal lobe. The first step if depression or anxiety are suspected in a child or adolescent shouldn't be a worthless assessment tool designed to show that everybody who takes the test needs drugs, but rather an assessment of things like the child's diet, habits, circumstances. Issues like performance at school, sleep, family dynamics, social media, screen time, and physical activities should be looked at and changes made where necessary. Medicating a kid who's having difficulty making friends or is having trouble paying attention because he sleeps only 4 hours a night due to overscheduling is unconscionable. It doesn't solve anything. For those who really do need assistance beyond just changing habits and diet, cognitive behavioral therapy has been shown to be much more effective and safer, and it does not lead to increased suicidal ideation or violence. You know, discernment is needed in order to determine who really does need help and who doesn't, and people who just need time to get over things or who need some assistance in addressing issues. But unfortunately, discernment is not taught and practiced in medical offices these days, so truly unfortunate thing. So stay away from these routine screenings. I'm going to keep talking about it until we get everybody in the country to understand it. All right. Now, another thing I want to talk about, it's kind of related to this issue here, has to do with parental rights. And you might remember a few months ago I covered a story about a family battling state authorities right here in Ohio, where I live, over treatment methods for their daughter who had leukemia. The battle is going on, and even scarier stories like this are happening all over the country. I'm going to talk about one today because I want parents to be aware of the state's capacity to take away their rights and even take children away if parents do not dutifully do what their doctors tell them to do. So here's the story. Marianne Godbaldo is a Detroit mom who opted to homeschool her daughter Ariana for quite a long time because she was born with a defective leg, which is amputated, and she used a prosthetic. So Marianne thought she might be more comfortable learning at home. In 2011, Marianne enrolled her daughter in school and brought her up to date on vaccinations. Following the shots, Ariana's behavior started to change. So Marianne took her to the Oakland Children's Center, and she told Daniel Zach, a psychiatrist there, that she thought that the changes might be due to the vaccinations since there had been no previous behavioral problems. Zach responded by prescribing an antipsychotic drug called Risperdal. Ariana's behavior continued to deteriorate for several months, so Marianne sought help from a second doctor to wean her off the Risperdal. When the Oakland Children's Center learned that Ariana was no longer taking Risperdal, they reported Marianne to social services and charged her with medical neglect. Now, what happened after this is it's like you can't even believe this goes on in America. On March 24th, 2011, Detroit Child Protective Services, without a court order, asked the police to remove Ariana from her home. A Detroit police SWAT team broke into the home, took the child, and placed her in confinement in a state-run psychiatric facility. She was placed on Risperdal and 3 other psychiatric drugs. Doctors took her prosthetic leg away. Marianne was arrested and charged with 8 felonies, and after 5 days finally was released on bond. It took 2 days for this mother to locate her child. Marianne's attorney was able to see the child and reported that she was drooling and despondent. Well, I'm sure on 4 antipsychotic medications she was. 2 months later, the child was released to the custody of Marianne's sister. In August of 2011, the felony counts were dropped after the court determined that the seizure of Ariana was illegal. And in September, the court ordered that Ariana be returned to her mother. Subsequently, the remaining child neglect charges were dropped. The thought that the state can take children away on a whim is frightening, and this is even more frightening. Mia Wink, the social worker assigned to the case, ordered the child to be taken by police without ever meeting the child or her mother. She told police she had a warrant when she didn't, and that they would need to have a cage in the car in order to transport Ariana from her home to the psychiatric facility. In addition to drugs, Wink authorized a list of immunizations to be given to the child while she was in custody. This and stories like it should be a wake-up call. We have got to rein in government at both the local and the state level and federal level. And it's time to start passing laws that hold government workers accountable for their actions, people like Mia Wink. If a citizen had kidnapped Ariana from her home without any, just broke in, took the child, and given her drugs and shots in captivity and took away her prosthetic leg, that person would be in jail for a very, very long time. But when government workers do it, there's no consequence. These people don't even lose their jobs. Between protection from unions and laws that make it almost impossible to prove that government workers overstep their bounds, they can get away with almost anything. And this absolutely has to stop. And I try to stay away from getting too political, but I guess the older I get, the less I care how much I upset people. I think it just goes with the flow in terms of the type of work that I do. But I talk to people all the time who say, I'm not interested in politics, I don't vote, I don't want to be tied up in all of that, it's too depressing. You know what? This is what happens when you're not interested in politics. Your rights get taken away. So we have elections in this country, and one real clear way to make our wishes known is throw these people out who allow this kind of stuff to go on. And I'm encouraging you to get active and do it. If we don't do it, we can't really sit around and complain that things aren't getting any better. All right, that's all for this week. As usual, pass this on to anybody who you think would enjoy watching it or get mad from watching it. That's okay too. And I will be back with you again next Tuesday.